Hi, my name's Rachel Corman. I'm the Feline Internal Medicine Specialist at Veterinary Specialist Services, and this is just a short information video for you on how we induce anaesthesia in feline patients. This is Bridget. She's one of our surgery nurses, and she'll be doing the anaesthesia for our patient today. All right, so it's important prior to anaesthesia of any patient to make sure that you have everything prepared that you might need. So what we're using here is we've just got a metal tray. We have our lignocaine here, just with a soft catheter tip, and that's for introducing into the larynx. So we make sure that we've got that prior to induction. We have a working laryngoscope with the bright light. We have our induction agent, so here we're using alfaxolone, and we always use that undiluted in a 1 ml syringe for cats. And then we have additional medications that we might need at induction as well, such as midazolam available too. We have a variety of uncuffed endotracheal tubes here, and our preference for cats, depending on the procedure, would almost always be an uncuffed tube, and we'll choose the largest uncuffed ET tube available for the patient's airway. And then we also have a couple of cuff tubes available just in case we're not happy with the uncuffed ET tube that's been put in place. If we're still getting a lot of airflow around the uncuffed tube, then we might change to a cuff tube. But remember, bear in mind that it's very, very easy to induce tracheal trauma and tracheal tears in cats with cuff tubes, and so you need to be very, very careful when you're repositioning cats, that you always make sure that you disconnect the ET tube from the anaesthetic tubing prior to moving the cats on either side. So next for our patient, we've got some constant rate infusions that are actually already running for this patient. This is a cat patient who's had some significant trauma and has some significant pain, and she's been on quite a lot of analgesia. So she's on a ketamine constant rate infusion and also a fentanyl constant rate infusion, and they'll be continuing throughout her procedure today. So now we're just pre-oxygenating our patient here, and she's been on oxygen now for a couple of minutes. And Bridget's just giving her some additional alfaxolone as an induction agent. Now we're preparing to intubate. So Shelley here is just holding the patient's head, using the laryngoscope so that we can easily visualise the larynx. We've got some lignocaine here for paresis of the larynx. Cats are very, very reactive when we try and intubate. Getting some more oxygen on board and some further induction agent. So again, just titrating to effect. When we're inducing, we always use the injection port closest to the cat so that we can be careful not to give too much flush to a patient. So observing the airway, observing the larynx. Preparing to tie the tube in place and just giving the patient some more oxygen while we're doing that. Now we have our airway secured and the patient is connected up to oxygen. This is our CO2 monitor just being connected in. And now we start assessing our different monitoring aspects. So we're making sure that we have a nice seal and that we can't hear any hissing sound of air leaking around the endotracheal tube. we can see that our CO2 monitoring trace confirms inspiration and expiration on our monitor. So this is a multi-parameter here that's showing our CO2 readings here and our SpO2 readings here. And we're just getting set up now with blood pressure assessment and shortly ECG as well. So the most important thing to bear in mind as well with any anaesthetic procedure in a cat is also just to make sure you pay a lot of attention to their body temperature. It's really, really easy for cats to become cold, particularly during long anaesthetic processes. So lots of monitoring of their body temperature, and also lots of things like bear huggers, heating pads, and also potentially little booties and lots of warm towels and things can also help to preserve their body temperature. You can see Bridget just put some eye care in, some lubricant to make sure that their corneas stay nice and hydrated as well. So the key thing is really just making sure you have everything prepared prior to starting. Make sure you think about and assess any underlying disease conditions for your patients. Have everything available that you think you might need, including multiple sizes of ET tubes, and making sure that you think about the monitoring for your patient throughout the procedure as well. So I hope this has been a helpful video for you, and please have a look at our website for further information.